Hello again, welcome to Survival TV. I'm going to give you another rundown of the survival snakebite kit. Just the basics and some of the finer points. And just remember, as we always say, we advise you to get training, get professional training, do a snake safety course, first aid course, and become familiar with snakebite first aid. It's not a subject you can know too much about. But I'm going to give you just a brief rundown on how to work the kit. This should contain everything you need to properly treat a snakebite. So our victim's gone down with a snakebite. I've pulled out the instructions. Things get lost in the fog of time, so it really does help to have a set of instructions. Manage the danger. Step one. Where is the snake? Has the snake left the area? You're not laying on the snake? No. It appears the snake's left the area, so we're going to commence first aid. So stop and drop. One of the key factors to controlling snakebite and preventing the flow of venom is to keep the victim immobilised and as still as possible. So Alison's laying down now. She's as relaxed as you could expect she could be. And I am now grabbing the bandage out. The bites happen on the hand, and I'm going to start the bandage off at the extremity or the end and work our way up. So I'm starting on the hand. I'm leaving the fingertips exposed. This is actually harder than it looks, and probably just relax your arm. In training, about 30% of people will drop the bandage, just unspool it and lose control of it in training. And I imagine in real life, it's more likely about 50% of people are going to lose control. So practice makes perfect when it comes to putting these on. I'm rolling it on, and initially, I'm not making it too tight on the fingers. If Alison's got to wear this for 3 or 4 hours, that's going to become quite tight. She's going to have a crushed handshake effect, and it might cause her to start to wiggle and move her hand to get some sort of relief, and we don't want that. The bandage, the SMART Bandage, is designed as a guide. Now, it's designed to get you in the ballpark to achieve the kind of pressures that you need to across a wide range of body types. But you must appreciate there is a difference between a child or a baby and an elderly person, and that needs to be taken into consideration. I'm catching the thumb, all good so far. At this point, I'm going to start to increase the pressure. I'm making the squares and I'm rolling it on. I'm only overlapping about 5 to 10 mil, so where you see the fine print on the bandage, that's about the overlap. If I'm running out of bandage by the elbow, I've just gone too far, I've overdone it. Wrapping it around, just relax your arm. It is harder than it looks to get it right. How's that feeling? Firm?
Firm.
Should be. As far as you can get the bandage, so you treat the whole limb. Once I get to the end there, I'm just going to, the excess here, I'm not going to roll back, I'm just going to tuck it in, sit it there, and just relax the limb. So that's step 3, check for danger, stop and drop, apply the pressure bandage, and now step 4, splint the limb. So I'm going to take this splint out of the kit, which is absolutely fantastic. This is what really makes the whole kit for me. So rather than mucking around with a sling and creating pinch points and so forth, and a whole lot of unnecessary movement as you try and work out a sling, we can put the splint on and do it all in one. I'm even going to mold it a little bit to make it more comfortable for you. Sit him on there, put it in. I'm just going to rest your arm there. I'm taking out my, well, some people, this is all they've got to do a snake bite with, is one of these old-fashioned crepe bandages. I'm just going to use this to attach the splint. I can see that the squares are pretty good, which indicates to me that the bandage is firm enough. And now I'm going to attach the splint. Just rolling it on. All the way to the top. I'm not actually bearing down really hard with this bandage, it's just for fastening and locking it in. Now, to check that I haven't put the bandage on too tight, that I haven't created a tourniquet effect, which is what we want to avoid, I'm just checking the fingertips. If I touch the fingertips, they turn white. Then I can see the blood, the colour coming back into them. That's vascular return or capillary refill. And that tells me that the blood's still circulating the arm, albeit slowed down by the pressure, but the arm's not been cut off from its life support. But with any luck, we've stopped the venom right where it is on the hand. I take out the marker, I put an X on the spot where the bite occurred. When we get to hospital, they'll peel that back, they'll take a swab of it, they'll be able to identify the snake. The victim looks very relaxed. It must be my calming tone of voice. So I don't need to do much work in that respect, but I will get on the phone now and call the emergency services and tell them exactly where they're going to find Alison. I'll wait with that till they arrive. And under no circumstances will I remove this bandage until Alison is sitting in the emergency room. The doctor is there, they have the antivenom, and they're ready to start the treatment.